am Susan Corbridge. I'm the Executive Associate Dean at the University of Illinois at Chicago College of Nursing, and I am a clinical professor in the College of Nursing, as well as a clinical professor in the Department of Medicine, specifically in the Division of Pulmonary and Critical Care Medicine. And I have been a nurse practitioner in pulmonary practice for almost 30 years, and I take care of an inner city underserved population in a pulmonary specialty practice. And I of course, see a lot of patients who struggle with nicotine addiction and who are at our clinic specifically because of smoking-related lung injury or disease, as well as those who continue to struggle with smoking. So I'm very passionate about working with individuals to try to help them quit. And in particular, my dissertation, when I did my PhD, I looked at adolescent nicotine addiction. And really, the important piece is to try to help individuals prevent ever starting to smoke if we can do that. I mean, I think that's one of the best things that we can do as nurses and as nurse practitioners. But unfortunately, there are many individuals who will progress on to smoking and become addicted to nicotine. And so, again, it's really super important that we are able to have the tools that we need to help them stop. So in my clinic, I think, when patients come in who will continue to smoke and explaining the dangers of smoking to them, it's really important that I try to find out what drives them and what makes them, really what has led to their nicotine addiction and how can I help them as we work through this process together. And I do really feel that I go through it with them. And I am also very, very fortunate because we work in an academic institution where I have we have a great interprofessional practice where I have individuals who are also pharmacists who are very expert in smoking cessation. So we really take a great interprofessional approach to smoking cessation. We also, we work together, the pharmacist and we are able to, we call our patients in between their visits and really work at explaining, again, why patients should stop smoking and how we can help them. And again, explaining to them and that we're part of the team and helping them overcome this. I think, that really has led to a lot of success with us because they do really look at us then as trying to really help them, and that's been very successful for us. I think when I explain the dangers of smoking in our patient population, again, many of them coming from an underserved inner city population where the smoking rates are higher in general, it's more of a thing where they're all doing it. So lots of people in their family, so they struggle, and so again, working to recognize that their friends and families are smoking and try to help them all if we can, because we know that if one person stops smoking, then if their friends and family continue to smoke, it's really hard for them to go through that process. So the biggest thing too, that when we explain the dangers of smoking, I like to talk about again, what's the most important piece for them with helping them quit. Many of them want to quit because they either have young children. They're scared of now they've been diagnosed with smoking related illness or disease. And so they're scared. And so they want to stop for that. We talk about, what smoking can do and the dangers of smoking. And really, I like to frame it more in a positive aspect about, what are all the benefits from stopping smoking instead of, really focusing on the dangers. I think they know that, but talking about the benefits and how when they stop smoking, really what they can reap from that. And that has also been very highly successful for us that we work with. Again, our interprofessional approach, I think, is really important. Several of us know the patients well. In our practice, we do have a very interprofessional approach to patient care. We have our nurses are integrally involved, our social workers integrally involved, our pharmacists, our pharmacy students, as well as myself as a nurse practitioner in our clinic. And so it really is helpful that with this interprofessional approach that we are able to also help each other with bringing any new literature that we find, or any keys or tips for success that have worked with other patients. We bring that back to each other as well. So it is one of the hardest things that we have to do, I think, with patient care, is trying to help people stop smoking. It's very hard, and we have a lot of patients also that have had struggled with illicit substance abuse, and many of my patients find it easier to stop illicit substances than they do from smoking and smoking tobacco, and the data support that as well. So I think that is important. And one of the things that I think is important too is that patients will come in and they often will, feel down on themselves because they want to quit. Most people do want to quit, and they want to quit, but they say, I've tried so many times and I just can't do it. And so I think when we share with them often that depending on the source you look at, some people can try to quit up to 30 times before they're successful. Although the data that we mainly share is about 5 to 7 times. But again, I just looked at a new paper that depending on the sources you look at, it's multiple times and can be up to 30. So I think if you tell patients, it's hard and people try and they're not successful on a number of attempts, but finally they will be. And so that's been a key that I look in my patients' eyes when I say that to them, and they really feel like, oh, okay, I'm going to continue trying then, because they, I think they get down on themselves often because they do try and then they feel like they're not successful and not able to do it. So sharing that type of information has been helpful for me as a practitioner. And I always share with them that famous Mark Twain quote where he said, quitting smoking is easy. I've done it hundreds of times. So it's, again, something that patients do feel down on themselves a bit if they can't stop smoking when they try. And so sharing that, the data that, you're not alone. Many people, and the majority of people, try to stop smoking multiple times before they're successful. But the key there is that, they can be successful. So that's always been very helpful as well, too. So again, I do think that in our practice, the keys for success is that we treat tobacco addiction as, something that we have to hit full on. And we do it from an interprofessional approach. And we do look at the literature and look to see what works best. We use typically a multi approach where we have counseling, as well as we use other resources, and then pharmacotherapy as well. And really sitting with the patient and figuring out what pharmacotherapy will be the best approach for them. Usually it's more than one that we do. Typically, sometimes we give 3 forms where we'll give something orally, as well as 2 forms of nicotine replacement. Sometimes it's a patch and then either a gum for cravings or breakthrough. And then also, an oral medication if they can get that. Some of our patients are not they're not good candidates for the oral medication. So we really look at 2 different types of nicotine replacement for them, as well as, again, the counseling and the constant, support with them as well. We do find that some of the tips resources are incredibly helpful. I really like the managing cravings. Cravings is something that our patients continue to struggle with. Even our patients who have quit smoking I have a patient who she's not smoked for 25 years and she still struggles with cravings. So we talk about it every time she comes in, and I continue to try to give her support for that. So I think too, we always look at, again, the positive things like those reasons for quitting, going back to that, why patients want to quit. And is it because of their family? Is it because they want to feel better? Is it because they are concerned about obviously the negative effects of smoking, and really going back to why they want to stop smoking, and I think that's important. And I know TIPS does a really good job and has some pieces, lots of support for patients that we use. I also like that we resources in the TIPS campaign are in Spanish, many of them, because we have a high number of patients that also are Spanish speaking, so that's been helpful as well. I also like on the TIPS campaign, they have resources there specifically for calculating savings. Again, a lot of our patients are struggling financially, and so it's important. Things like that is another benefit of quitting as well. And, keys too that I find important, again, when you think about triggers, we spend a lot of time talking about patients that are talking with patients about why they smoke, and really looking at the triggers. We do trigger plans for our patients, and we walk through those triggers. What are the triggers that help patients smoke? And the TIPS campaign does a really nice job as well, providing resources for that as well. And in addition, when we walk through triggers, if patients are smoking, if they tend to say they're smoking more for emotional reasons, whether it's stress, which I've seen a lot of recent, in particular related to the COVID pandemic. But we really have done a great job with, I think, and they continue to tell us that, we continue to reach out to them, even though we've switched our clinic to telehealth right now. It's actually been really great for helping with counseling for smoking cessation, because we've been able to call them much more. Our pharmacies, our pharmacists and our pharmacy students call them more. And we've really been able to do more of the counseling and working with smoking cessation. So again, looking at triggers and stress, and I think stress being a big piece for triggers, and then trying to help them talk about really what their triggers are and how we can help change that around. And I try to get my patients to exercise more. I think that's really important. And again, recognizing that there is a lot of additional stress right now, in particular with the pandemic and some of the other things going on in the world. And so it's really been important to focus on these triggers and, again, that uptick in smoking and how we can help them with that. I think also, if you look at other triggers that we particularly try to help patients with, and again, the TIPS campaign does a great job with focusing on some of this, but it's also patients smoke out of habit or pattern. For instance, my patients sometimes will say, every time I have my coffee in the morning, I have a cigarette. So how can we help them? How can we identify that and then help them break that habit or routine? So part of that is that we try to work with them on first of all, identifying is key, but then really trying to work with them to say, how can we break that? Let's try to do something different. Try to mix up your routine a bit. Exercise is key. Walking is key. If patients can walk, if they can do something else at the time instead, and try to change up their routine, and that's important. And again, the TIPS campaign does a great job with providing resources and information, particularly with that. Other reasons that patients smoke and other triggers that when we identify triggers, it has to do with the social piece. They'll say, I always smoke when I'm around so-and-so because they smoke, and that's just what we've always done together. And so, we try to work with our patients to say, well, can you meet with them in an area where you're not able to smoke? Could they come over to your house where you're trying to make your house smoke-free instead of you going to their house? So, really working with them in that regard, I think, is key. And then also, again, helping them try to deal with the withdrawal. What is the best way and what would be the best pharmacotherapy approach for them that we could help them with as well. So I do think, the resources that are there are really great, including the Quit Now. We do the Quit line. We have, we always refer our patients to the Quit line, and that's been very helpful for many of our patients as well. And there is a Spanish piece of that too, which is so very important for the patient population we serve. And I think our biggest, our practice pearl that I was talking with our pharmacist and about this, because again, we have a very interprofessional approach to patient care, which I think is key. And our patients really like that as well. But we were talking about, what we really thought our biggest practice pearl to help patients with smoking cessation. And we have a couple. One, I think, is that we hit this head on every time patients come in. And it's one of the things that patients, they don't want to talk about it. They're feeling, most of our patients, as I mentioned, and the data support this, they do want to quit. And so if they haven't quit, they feel bad. And so they're nervous about talking about it, but we need to bring it up. We need to get it out there right on the table. And they actually are happy when we do. And we've had many patients that say that. So we bring it up, we look at it, we hit it head on, we bring it up. Every time they come in, we spend a fair amount of time on smoking and smoking cessation. And even if they've stopped smoking, we always congratulate them on their success and continue to talk about, are they having cravings? Can we help them with that? So again, I think a practice pearl is that can't forget this. And every time patients come in, you need to ask, because even if they have stopped in the past, they may have started again, or they may be dealing with cravings, and which would, more likely have them start again. So I think it's just, that's really been helpful for us as we hit it head on every single time a patient comes in. We discuss it. And if patients are not smoking, we continue to tell them, the benefits of not starting and to avoid secondhand smoke, especially many of our patients with lung disease. It's super important that they are avoiding any secondhand smoke. So we talk about that as well. The other practice pearls, that I think are that have helped us when, again, we use the resources, we walk through trigger plans, but we talk about the D's with patients. We always hear about the R's and the A's, but we talk with our patients about the D's as well when they're trying to quit, and that's been helpful. And one of those is to do something else. So when they start to want to smoke, then we say, well, do something else. Try to think about, okay, can you go take a walk? Can you change up your routine? The doing something else, patients have said, has been helpful. One of the other D's is to deep breathe and just to take some deep breaths when they're feeling that they really want to smoke. And, that's one of the things that we talk about too. And then just to delay, if they can delay that cigarette, if they can just delay it a little bit, sometimes it helps to delay the craving and they're able to, to get by without a cigarette. And then drinking water. Another tip that we tell patients is to try to get a water bottle that has a straw on it. And if they're able to suck on that straw, that sometimes can help them as well. So these are some of the tips and tricks that we use with our patients. But again, I think the biggest practice pearl is that you just have to focus on this every single time a patient comes in and really focus on the dangers of smoking as well as the benefits of quitting if someone is addicted. And then, really, again, something that I think is very helpful and to patients that I've seen over the last 30 years is when you commit to them as their partner in helping them through this process and say, I'm going through this with you, and we're going to come up with a plan that is, helpful for you and it's tailored to your individual needs.